Hello, everybody. Today we are going to investigate the cause of the death of an unfortunate upper lateral incisor. Are you curious as to what happened? Keep watching the video. I promise you, this is going to be very interesting. Now, what is the story? The story is that of a beautiful 22-year-old female patient who had an accident around 4 years ago and she lost her upper left central incisor. So, in order to replace the lost tooth, a fixed partial denture was given by her dentist with the adjacent teeth as the abutments. She didn't have any problem all these years, and 2 months ago, she developed pain and swelling in relation to the lateral incisor. So, she went back to her dentist and they attempted endodontic treatment through the crown of the tooth. And they found the canal to be calcified, so they referred the case to us. So when the patient came to us, she had a very beautiful prosthesis and clinically there were no abnormal findings as she was already on antibiotics. So we took an X-ray and on the X-ray we could see that an access opening had been attempted which was slightly deviated towards the distal side and the canal seemed to be calcified at least in the coronal third. There seemed to be evidence of a canal in the middle third. Also, we could see some radiolucency in the middle third of the root, which could be the superimposition of the trabecular pattern or it could be something pathological happening on the root. So, in order to ascertain whether this is inside the tooth or outside the tooth, we took another radiograph from a different horizontal angulation. Now, in this angulation also, we could see that the radiolucency is on the root. In both these radiographs, the radiolucency appears on the root of the tooth itself. So this means that it is associated with the tooth and it is suggestive of some sort of resorptive activity going on. So we sent the patient for a CBCT scan and it confirmed that the tooth had a calcified canal at least till the middle third. Now I'm going to show you the beauty of the CBCT. In a CBCT scan, using the software, you can take serial sections of the tooth in any plane. So these sections are of 1 millimeter thickness, which have been taken, and you can view the images here. So this yellow line, this one, is exactly on the mesial surface of the tooth, that is here. So here you can see a radiolucency which is suggestive of resorptive activity, and since this is started on the external surface of the root, this is an external root resorption. This picture clearly shows the moth-eaten appearance on the mesial surface of the root, which is typical of odontoclastic or resorptive activity. Now, another interesting finding is that the resorption was not limited only to the mesial surface. You could also see some resorptive activity going on the labial surface of the tooth with the loss of the labial cortical plate. In this slide, you can see the labial resorption from different views. This is the anteroposterior or the coronal view, which is very similar to our intraoral preoperative radiograph. This is the sagittal view where you can see the tooth in a mesiodistal direction, and here you can observe a notch-like resorptive lesion on the labial surface of the tooth. This is the axial view where you can take horizontal cross sections of the tooth, and this section has been taken at the level of the resorption, and again you can observe the labial notch-like resorption here. This is the 3D reconstruction where again you can see some resorption taking place over here with the destruction of the labial cortical plate. This is a very interesting picture. This is what I used to explain to the patient about the seriousness of the problem. See here you can see the two different resorptive lesions, one on the mesial and one on the labial. Now this is the 3D reconstruction. See, this is the mesial resorptive activity and this is the labial resorptive activity. I am extremely thankful to Dr. Nima Francis for providing me the CBCT images and the reports. Thank you, Dr. Nima. After looking at the CBCT, I had a discussion with the patient and her parents, and I told them that this tooth actually had two problems. One was the calcified canal, and the other was the more serious one, that is the external multi-surface root resorption, which made the prognosis for endodontic treatment for this tooth very questionable. So after listening to me, they took a decision to go with extraction and to replace the central incisor and the lateral incisor with implants. The patient was again referred to an implantologist by me, and he's a good friend of mine. So he extracted the tooth, he put an implant there, and he was very kind to send the extracted tooth back to me so that I could take a look at it. So I take this opportunity to thank Dr. Sebastian Thomas, an implantologist and my neighbor, for the kind gesture. So when I received the tooth, the extracted lateral incisor, the curious child in me woke up, and I decided to put my microscope to good use, and I examined the extracted tooth under the microscope. Let's see what I found. This is the tooth observed under magnification, and you can see that this tooth looks pretty normal. Other than that, there is something like a granulation tissue attached to the middle third of the root. I then removed the tissue with the help of a spoon excavator, and then I looked at it again under magnification, and you can see the notch on the labial side of the tooth, and you can also see that the root is very rough apical to the middle third, and it is much smoother coronal to the middle third. This is a picture of the tooth I took under high magnification, and this is the preoperative radiograph. Now see how well both these correlate. See, the tooth looks very sharp over here. The apex of the tooth looks very sharp. What didn't occur to me at that point of time was that this whole portion was being resorbed. That is what is happening here. This is the labial notch. The labial notch, which we saw in the CBCT. See how well it correlates with the CBCT? My take home message for you in this video is that no case is simple, not even an upper anterior tooth. And you have to suspect everything. Anything can happen anywhere. And to suspect anything, you have to have thorough knowledge of your subject. You have to know what is normal and what is abnormal. And you should use CBCT wherever necessary because it is a very powerful diagnostic tool and it correlates so well with clinical findings. I proved it right now, right? And sometimes you should have some fun with your microscope too. Thank you so much for watching. I hope you enjoyed the autopsy of the extracted tooth. Have a great day.